Good afternoon, and thank you for joining us for today's virtual media briefing about COVID-19 in London and Middlesex County. We're glad to have you along with us. Also happy to be joined this afternoon by the Mayor of London, Ed Holder, as well as the Acting Medical Officer of Health at the Middlesex London Health Unit, Dr. Alex Summers, and Carol Young-Ritchie, the Executive Vice President and Chief Nursing Executive at London Health Sciences Centre. Also happy to be joined by the members of the media this afternoon. We already have a few questions in the queue, but there is room for more, so we do welcome those questions. All you need to do is click on the question mark inside the text bubble here on Microsoft Teams, and when you do, if you could indicate your name as well as your media outlet and who your question is for. And finally, a welcome to those tuning in this afternoon on Rogers Television, as well as the Rogers Facebook page and YouTube channel, and viewers who are joining us on the CTV London website. Let's get to our opening remarks, and we'll start today with Mayor Ed Holder. Mayor Holder.
Well, thanks, Dan, and good afternoon, everyone. 1 week ago, kids across the region went back to school. 1 week from today, restrictions begin to ease for thousands of local businesses. I know this has been a yo-yo, somewhat of an up and down for our families, our businesses, but we're seeing clear and continued signs for optimism. There are numerous indications. We've hit our peak when it comes to infections, and now we're starting to see some encouraging trends when it comes to hospitalizations. Speaking of which, it's rather interesting that today we mark the second anniversary of the first COVID case diagnosed in London. We'll all remember that Western student who came back from Wuhan, and because of her foresight and forethought, she had herself checked out, and thereby preventing potential for greater illnesses as a result of her infection. As we've seen during previous waves, we have to make sure we remain committed to doing the right things, even as this situation begins to improve. So if you haven't had your chance to book a third shot, please do so today. Demand is starting to ease. There are some facilities, which I'm sure Dr. Summers will mention. And last week, I know he mentioned Nichols Arena, where you could just walk in and get that confirmed. And I'm sure he'll confirm that again today. But there are numerous options available, options that weren't as readily available a few weeks ago. And of course, you've got your general practitioner and pharmacies and others too. So no reason not to book your third shot if you haven't. And I'd like to stress the need for 5 to 11-year-olds to get their first and second shots. Look, we're over 54% in that age group, whereas the 12 to 17-year-old crowd has a vaccination rate of something over 90%. Bravo. If we could get our youngest population vaccinated in a similar degree, it would go a long way towards ensuring the preservation of our healthcare system. For all the talk of variants and breakthrough infections, one thing has remained constant, and that's this. Even if you get COVID, those who are vaccinated are exponentially less likely to wind up seriously ill or in hospital. And that's what this has been about from the start, keeping people as healthy as they can be, keeping our healthcare system from being overrun. Vaccines are doing what they were intended to do, and they remain our best hope of ensuring that the positive trends we're now starting to see are able to continue in the coming weeks and months. That's our hope, and that's our expectation. So that's it for me now. I'll turn it over to Dr. Summers.
Thank you, Mr. Mayor. 2 years ago today, the Middlesex London Health Unit was notified of the first probable case of COVID-19 in our region. And over the course of 2 years, it has been an up and down journey as we have tried to slow and stop the transmission of COVID-19 and its subsequent variants in our community, sustain our health system capacity, and avoid unnecessary deaths associated with COVID-19. The arrival of the vaccine just over a year ago was a major step in ending this pandemic and minimizing the harms of this pandemic. However, we continue to deal with the Omicron wave today. A number of cases were reported over the weekend. We continue to report on most days over 200 cases. Today, we're reporting just 140 cases. The trend is favorable. However, the burden of COVID-19 from the Omicron variant remains the highest it has ever been in our region. We have also sadly reported a number of new deaths in our community associated amongst individuals who have been vaccinated. This again highlighting that although the vaccine is critical with 2 doses, that booster is essential when it comes to the Omicron variant. The other thing we're reminded, and I want to highlight this most critically, is that the vaccine still remains the most important thing you can do to reduce your personal risk of infection, severe illness, hospitalization, ICU admission, or death. It is absolutely critical. The rates of death and severe illness amongst unvaccinated individuals at all ages remains higher than what we would see amongst vaccinated individuals, and particularly those with the booster dose. The province has indicated reopening steps that will be taken a week today as we hopefully see an ongoing improvement in critical markers of COVID-19 transmission in our community, including the percent positivity of the tests that are done, the wastewater data that is collected, as well as hospitalizations and ICU admissions. Those reopening details will continue to be more available as the week unfolds. And again, we hope and will anticipate further clarification that we're moving forward with that reopening coming on Monday, January 31st. In the meantime, the urgency to get vaccinated and to get boosted remains. And across our region, those opportunities abound. The Earl Nichols Mass Vaccination Clinic is now accepting walk-in appointments in addition to booked appointments. So anyone 5 and up who is eligible for a dose of vaccine is eligible to walk into Earl Nichols and receive a vaccine. Booster doses are available to anybody 18 and over, and first and second doses to anybody between the ages of 5 to 17. We've received lots of questions on when 12 to 17-year-olds will all be eligible for that booster dose. We don't have that information yet from the National Advisory Committee on Immunization, but we anticipate it at some point in the near future. Our mobile efforts also continue in partnership with the Middlesex London Paramedic Service as well as MLHU staff. As of last Thursday, the MLHU mobile team had visited 4 shelters in our region and administered 145 doses of the COVID vaccine. We continue to visit shelter and congregate living locations in the coming week. We will also be announcing later this week a number of community hub COVID-19 vaccination clinics in schools to roll out through the beginning of February in some communities in our region where vaccine uptake has been somewhat lower than other regions. Watch for that announcement. And if you're a parent or guardian, I strongly encourage you to get your 5 to 11-year-old vaccinated as soon as possible, in light of the fact that that vaccination coverage remains the most important thing we can do to limit COVID-19 exposure, transmission, and transmission to those that are most vulnerable. Thanks to all who continue to roll up their sleeves as we continue to weather our way through this Omicron wave. With that, I'm going to pass things over to Carol Young-Ritchie from London Health Sciences Centre.
Thank you, Dr. Summers, and good afternoon, everyone. And thank you for having me here to share the COVID-19 update situation at London Health Sciences Centre. As of this morning, we are caring for 143 COVID-19 positive inpatients, with 23 of those patients being in critical care. Our Children's Hospital has 5 or fewer inpatients with COVID-19 and no patients currently in our pediatric critical care. At this time, we've received 5 or fewer critical care patients from hospitals throughout the province and continue to be available to provide further support as directed by the Ontario Critical Care Command Centre. We currently have 6 units on outbreak. This includes 5 at University Hospital and 1 at Victoria Hospital. But we cannot share the number as it's less than 5. I'd like to take the opportunity to offer our sincere condolences on behalf of LHSC to the families of our patients who have died of COVID-19 associated with the current cluster of outbreaks. We continue to work with our partners in infection prevention and control, as well as the health unit, and we are hopeful that we will see several of our outbreaks declared resolved in the upcoming days. Finally, I'd like to take a moment to acknowledge our regional partners. Last week, we had to transfer several patients in order to create much needed capacity at LHSC. While the number was low enough that we can't reveal the specifics due to patient confidentiality, I'd like to acknowledge what a great help this was in easing the burden we are facing and express our appreciation for their partnership and teamwork in providing the best possible care to our patients throughout Southwestern Ontario. Thank you.
Thank you, Carol. Thank you, Dr. Summers, and thank you, Mayor Holder. We do have a bunch of questions in the queue, so let's get to those right away. The first question this afternoon comes to us from Merrick Sutherland at CTV News. And This is a question I think Merrick is looking for comment from everybody. So as this is the 2-year anniversary of the first COVID case in London, could you reflect on what that was like? Oh, actually, as I'm reading it, Dr. Summers, I think this is for you, what that was like from a health unit perspective and a city perspective. So yes, Mayor Holder, we could hear from you as well, and Carol, if you have any comments as well. The unknowing nature of the virus that had suddenly shown up on our doorsteps as one of the first cases in the country. So a bit of a reflection going back a couple of years. Dr. Summers, would you like to begin?
Certainly, Dan, and Merrick, thanks for that question. I think it will be hard for me to fully capture the experience of that first case and the subsequent weeks and months that unfolded, let alone the totality of the experience as a public health professional in the last 2 years. In terms of the initial experience, we had known in late 2019, early 2020 that something was rumbling across the world from us, and we did not know what its impact would be on us, but we were watching closely. Its arrival was striking, it was concerning, it was in so many ways still an unknown. We certainly didn't know how profoundly COVID-19 would impact our community, how rapidly it would prove to transmit in other jurisdictions and eventually in our jurisdiction here in Middlesex, London. I think we at the time certainly knew that a pandemic was always a possibility, but it still at the time was not clear whether or not we would actually see sustained COVID-19 transmission in communities beyond Wuhan. I think it's going to take a number of years for any of us to fully reflect and fully unpack what this experience has been. I think we are still so much in the thick of it that there is very little time still to fully reflect on what those early days were like. I have said to others before that January to June of 2020 will forever be one of the most remarkable times in my life. And it was started in many ways 2 years ago today. Happy to hear other comments for sure.
Yes, thank you very much, Dr. Summers. Mayor Holder. Oh, Mayor Holder, I think you're on mute, sir.
Thanks. I appreciate Dr. Summers' poignant comments because when you think of what our whole community has gone through over the last 2 years, there's not enough words with EST at the end that would ever explain it. It's dramatic at its most. But I think if there's a word that comes to my mind as I think of this last 2 years and this second anniversary, and I see how people have come through this, how businesses and our economy have come through this, resilience is the word truly that comes to my mind as far as from our perspective, the resilience of our citizens, resilience of our businesses. Look, not every citizen made it, and that's a tragedy. Not every business made it, and that's sad for those people who put their savings and their worlds into their businesses and for those employees impacted. But governments have tried to stand tall through it, and without other levels of government and this municipal government, it would have been a far different circumstance as to how we've dealt with it. But people have come through it. People have come through it as well as they can under the circumstance. And it speaks to how we deal with tragedy and how we deal with the very toughest of times. I can only imagine that for all of us, this has been the most unique 2 years that any one of us could ever have imagined. But we're coming through it and we're getting through it. And while they say what doesn't kill you makes you stronger, well, sometimes it just kills you. But in this case here, I think this is a point where we're London strong, and I'm so proud of all the citizens of this community.
Thank you, Mayor Holder. And now if I'd like to turn to Carol Young-Ritchie from LHSC.
Yes, thank you. And a lot of emotions come to play when I think about the last 2 years. I would say in the healthcare sector, this has been quite a 2 years. We've learned a lot. This pandemic has evolved over the past 2 years, and there's been a lot of ups and downs, and every wave has been different. I think certainly what I think about is how certainly we've all pulled together from many different sectors as a community here in London. And I guess I would also say I'm really proud how LHSC has worked through the challenges, and very proud of our staff. It's been really, really difficult. It continues to be difficult. And it's not, I thought it was going to end after wave one, and certainly it didn't. It kept going, and not sure where it's going. But it's been a long 2 years, and we're not out of the woods yet. And again, really proud, and really proud to be part of this healthcare system.
Thank you very much to all of you for those responses, reflecting on 2 years since the first COVID-19 case in London and Middlesex County. Let's go to a follow-up from Merrick Sutherland. And it's a follow-up to that question. In the 2 years since that first case, what is something that sticks out as either an evolution of the healthcare system or an event or moment that remains top of mind from the pandemic? Mayor Holder.
And let me start this time if I can, because this gives me a chance to do a tremendous shout out to our frontline workers. And we talk about our healthcare heroes. What about our hidden heroes? The folks who work in administration and dietary services and orderlies, and folks that frankly don't get the attention that we often think of with our great nursing system, our great doctors, our great healthcare professionals. But honestly, the biggest moment here for me is when I see how London has come together to support all of our professionals within the health industry. And we're just so grateful. And it gives me a chance. I had to say that before Dr. Summers, because my comments might be a bit schmaltzy, but they're extremely sincere. All London is grateful for the work that our great hospital system has, our health unit, and anyone involved in healthcare in the front or in the trenches, as we often say. Heartfelt thanks, and you save lives, and you are all angels of health.
Thank you very much, Mayor Holder. Who would like to go next?
I'll just quickly thank the mayor for his comments on behalf of folks that aren't on this call. I think when I think of the hidden heroes, there are so many, and our thanks certainly to them is abounding. I think when I reflect over 2 years of a healthcare system, I think the relationships between players in the healthcare system has grown almost exponentially. And I think our capacity as professionals to think as a system, to think as a whole, to be so reminded each and every day that we are interdependent on one another. And not only that, beyond the health system, we are dependent on everyone in our community. Health is not limited to healthcare. Health is the manifestation of our lived experience as people in our community. The health of our neighbor impacts the health of ourselves. It has always been true. However, the pandemic has driven that home, I think, for many, and certainly for those within the health sector. And I think that I hope, is a legacy of this pandemic, which will continue to inform how we understand health of neighbor, health of self, and health of community.
Thank you, Dr. Summers. Carol Young-Ritchie, any additional comments you'd like to share?
Yeah, I'll just say, as we think about this pandemic, it just reminds me that that regular life goes on too. And I'd just like to thank our patients and families who've been with us over this 2-year journey, who haven't had COVID and done many of the things we've asked them to do. That's meant visiting restrictions have been limited. People have come in and had babies. And we've had a lot of changes here at the hospital. And just, as we're trying to do our best to get through this as healthcare providers, I just really also want to thank the community who's also supported us as we've had to put different restrictions in place, which we know have been difficult at times.
Thank you, Carol Young Ritchie. Let's go. I think Mayor Holder, you had another comment.
Yeah, just very briefly. Over the 2 years that we've done this together with Dr. Mackey, now Dr. Summers, Carol Young Ritchie, and the wardens that we've dealt with, Kathy Burkhardt Jessen and Allison Warwick. I've been pretty clear about what I feel about unvaccinated folks, and I have had limited tolerance. And sometimes that's not fair, because there are many reasons why, from education and all, that we would like to extend an olive branch. But what we don't do enough of? We don't say to the 90+% who got vaccinated, thank you. Thank you for getting single, double, boosted, whatever it's taken to be healthy, because you're the other hero group, and we need to acknowledge you as well.
Thank you very much, Mayor Holder. Let's go to our next question. Jane Sims from the London Free Press is joining us this afternoon. Dr. Summers, the MLHU dashboard is reporting another death today and 4 on Saturday. How many deaths have there been this month? What should we brace ourselves for during the next couple of weeks? And what is the vaccination status of the people who have died?
Thanks for that question, Jane. I don't have the final number on the number of deaths that have happened this month. It is over 30, and we anticipate more deaths between now and the end of the month. These deaths are sadly anticipated given the tragically high case counts that we have seen. The vaccination profoundly reduces the risk of death amongst all age cohorts, but it does not make it zero. And therefore, as the case counts go up and up and up, the probability of a death then becomes a certainty. And I think that's what we've experienced throughout January. What you are seeing now is deaths amongst older individuals who are vaccinated. What we have to remember is that the death count would be significantly higher if not for the vaccination. There are a number of people who have not died because they are vaccinated and would have if they had not been. And we continue to see higher rates of death, severe illness, hospitalization, and ICU admission amongst those who are unvaccinated relative to those that are. However, a majority of our population is vaccinated, and to those we're thankful, but that is also why we still see more numbers, absolute numbers of deaths amongst that group. I would just again finish by just strongly stating that the impact of the vaccine cannot be understated, even as we see deaths amongst those that are vaccinated. Over the next number of weeks, I do anticipate we will still see hospitalizations and deaths. We are starting to see a plateau of hospital admissions, and that's good. That typically reflects a plateauing and decline in the number of deaths. And of course, that is the outcome that we're hoping for. However, we still will likely, given the high case counts we continue to see some deaths in the future.
A follow-up question from Jane Sims for you, Dr. Summers. How concerning is it that, as of the last statistical update a week ago, only 54.1% of kids between the ages of 5 and 11 have had their first vaccination, particularly now that school is back in session?
The over 50% of 5 to 11-year-olds have received a dose of vaccine, and of course that's a success story, but we've got another 46% to go. And I think the plateauing of uptake amongst 5 to 11-year-olds is in some ways predictable. We know that there is always the first 50% that have rushed out of any given age group to get vaccinated, and then the subsequent 25% to get us up to that 75% mark takes a bit longer, and the last 15% to get us up to 90 takes the longest. So this is a fairly anticipated direction, and particularly when you think that we really had started with gusto on 5 to 11-year-olds, and then came the Omicron wave and the shift to booster doses and all that stuff. So there was other, I think, demands amongst our community that may have resulted in a slightly slower uptake amongst 5 to 11-year-olds because of availability. And that's why I want to highlight again, vaccine appointments are available. You can walk into Earl Nichols, you can book an appointment at Agriplex or Caradoc or Earl Nichols. We will continue to provide mobile options, an increasing number of mobile options, pharmacies, primary care. There are so many places to get vaccinated. The vaccine is safe and effective for 5 to 11-year-olds, and it is strongly recommended by me and the health unit. And so for parents and guardians, please do not wait to get your child vaccinated as soon as possible. We will continue to look at different ways to provide opportunities for vaccination and opportunities for people to ask questions about vaccination for 5 to 11-year-olds, because we know that for some it just has not necessarily been the right time to proceed for your 5 to 11-year-old. But that right time needs to be soon, and so we'll continue to make that vaccine as available as we can.
Thank you very much, Dr. Summers. The next question is for, I'm just looking for it here. Yes, it is for Dr. Summers again. It's from Travis Dolany at CBC London. Dr. Summers, we heard some teachers were fined at a South London elementary school for health violations Friday. Were you made aware of any infractions? And if so, can you speak to the issue?
Hi, Travis. Thanks for that question. I'm not aware of that circumstance and not able to provide comment. I'm sorry.
All right. Thank you, Dr. Summers. And there was a question I clicked too quickly, and it was for Carol Young-Ritchie. So I'm going to come to you with this next question. It's from Jacqueline LaBelle at Global News Radio 980 CFPL. And she asks, how many beds has LHSC transferred to free up beds? How many patients has LHSC transferred to free up beds? Will more patients be transferred, or is this policy winding down as hospitalizations due to COVID-19 appear to be slowing?
Thanks for that question. On a regular day, we move a lot of patients into LHSC and then back to their home hospitals. That's usually part of our regular practice. What we had done last week, our regional hospitals had some bed capacity, and as we were filling up at LHSC, we did reach out to those regional hospitals to see if they could take some of our patients who would generally have their stay here at LHSC. So some of those hospitals had the staff and had the beds, so we did move a small number of patients out to regional hospitals. We will likely monitor that again in the upcoming days, depending on the situation. Certainly, we'd like to keep people here at LHSC who come here, but again, wanting to balance many of our specialty services that we provide with the beds that we have available. So likely as this tapers off, we will move less patients. And again, when we do make that decision to move patients, we make sure that the receiving hospital has the ability to care for the patient, and we work with families to move that patient.
Thank you very much for that, Carol. Let's go to the last question. And again, I clicked a little too quickly. It's also from Jacqueline LaBelle at Global News Radio 980 CFPL. Dr. Summers, have you had a chance to look at Ontario's new school absenteeism reporting system? Is the data in line with your expectations? And could you explain why is the threshold set at 30%? Locally, Franklin D. Roosevelt Public School in London is reporting 29.5% absenteeism. With it so close to the threshold, should the school even be notified?
Hi, Jacqueline. Thanks for that question. Yes, so the reporting of absenteeism by schools is being done at the provincial level. The school boards report to the Ministry of Education. It's reported on the provincial website. The formal threshold that was established was 30% above baseline absenteeism, because we know that on any given day, there is always going to be some people away from school for non-COVID reasons. And the spirit of this is that we want, and the Ministry of Education wants to report on sudden increases in absenteeism that are likely reflected of increased respiratory illness activity in that school. So over a short period of time, absenteeism isn't running at 30%, but it actually goes up by 30%, suggesting that some type of respiratory illness is causing increased absenteeism within the school. That's the nature and spirit of the reporting here. And the reason that that signal is being tracked is that provides an opportunity for the school community to disseminate additional information from the health unit and the school to disseminate additional information from the health unit to the community about what to do to protect yourself from respiratory illness. So a kind of a reminder of all those things we already know to do. Get vaccinated as soon as possible, stay home if you're unwell, screen and monitor yourself for symptoms, and stay home, of course, if you're sick. Those types of reminders will be critical. So as we settle into a cadence here, as schools are now back for a week, we will be monitoring in partnership with our school boards that sudden rise in absenteeism and using that as the trigger to provide additional reminders and information to that school community so that people can again be reminded what can be done to protect the community, their families, and themselves. So that's really the nature of that reporting. again, the thing I want to emphasize is that the steps that you take to protect yourself in those instances are the same that we need to do at baseline all the time, and as we've discussed in length before.
Thank you very much, Dr. Summers. Thank you, Carol Young-Ritchie, and thank you, Mayor Holder, as always, for your insights, your information, and your input as we continue to provide this information for folks when it comes to COVID-19 in London and Middlesex County. That does bring us to the end of our questions and the end of today's briefing. Thank you for joining us. We'll be back with our next virtual media briefing coming up on Thursday. That will be the 27th of January. We hope you'll join us then. Between now and Thursday afternoon, have a great rest of your Monday, and so long for now.